We kindly ask you to be seated. Ladies and gentlemen, welcome to our panel discussion titled The Pulse of Security, Securing the Healthcare Sector Amidst Technological Disruptions. Our moderator is Lara Habib, Senior Presenter, Al Arabiya News Channel. Our panelists are Dr. Richard Staynings, Chief Security Strategist, Celera and Teaching Professor, University of Denver, Professor Junaid Nabi, Senior Fellow, the Aspen Institute, Mike Fell OBE, Director, National Cyber Operations, NHS, England. Lara, over to you.
Good morning, everyone. Thank you for joining us for today's session on securing the healthcare sector. As we all know, healthcare is increasingly relying on technology, whether it's interconnected systems or online platforms to deliver vital services. But with that reliance comes growing cyber threats. In fact, recent research from Checkpoint Software shows that the healthcare sector experienced an average of around 2,000 cyber attacks per week in the second quarter of this year, increasing by 15% compared to last year. That puts it in third place, just right behind education and military, as one of the most targeted sectors. Hackers target hospitals, not just because they're a goldmine of data, but because many facilities are easy targets, still operating on outdated systems and devices. Needless to say, this is a very serious issue. Cyber attacks are not just about accessing health insurance information and medical records. They can force hospitals to shut down critical systems, putting patient care and even lives at risk. So how do we navigate this? How can we protect our systems while still embracing innovation in healthcare? This is what we are exploring today with my expert panel lined up. I'm very excited to dive into this conversation with you all. Dr. Richard, let me begin this conversation with you, and let's try to understand why are cyber attacks increasing on the healthcare sector. I've mentioned some points in the introduction, but I would like to hear your thoughts on that.
Yes, thank you, Lara, and thank you for your attendees, your excellencies, for inviting me here to speak today. I think there are a number of factors that are particularly relevant when we look at healthcare cybersecurity. Firstly is the changing digital landscape of healthcare. Healthcare is undergoing perhaps its biggest transformation in its entire lifetime as a profession. We are integrating and building out digital systems at a fantastic rate across countries to increase the efficiency of the delivery of healthcare services through interoperability and exchange of data in a meaningful way, and to provide our physicians and other clinicians with the information at their fingertips that they need in order to help drive improvements and outcomes in healthcare. That digitalization is having an impact on the threat landscape of healthcare. It is vastly increasing the landscape, the target area, as it were, of data that hackers could use to attack our systems. That is one of the drawbacks of this evolution. We are in the middle of this change right now, and my hope is that within a few years we will get to the point where cybersecurity has caught up with those technological changes. The second point I want to make is the fact that today healthcare is an easy target. It's the soft underbelly of critical infrastructure industries, and it makes for a very easy attack target. We have an industry that is full of high-value data, personal health identity information, PII, PHI, personal health information, and that is valuable to criminals. So is the availability of our systems, and that's why we're seeing so many ransomware attacks. Hospitals need to be up and running in order to treat patients, and if those systems are down for any reason, then that obviously presents opportunities to those criminally minded to hold us to ransom or other forms of cyber extortion.
It's interesting to know that medical records are being sold for to $50 per individual on the dark web. This compares to $5, the cost of stolen credit card numbers. So this is very interesting. What are your thoughts here, Junaid? Is it ransomware the main cause behind these cyber attacks?
I think the first thing is that healthcare data is unlike other data, like you were mentioning earlier, the credit card data or the social profiles we have. Because unlike credit card information or bank information, healthcare data doesn't change that much. So if someone has access to it, it's a bigger problem because you can't change, you can't reset your data like you could for a credit card. So that's why it's more valuable. And that's why, like you were saying, on the dark web, it has a higher price. And I think what's happening is that with the rapid digitization of healthcare services, we know that in the Middle East, for example, or even in the US or other countries, telehealth is becoming more common. People are sharing their information with their physicians online, whether it's a video chat or a text chat. So these developments, and then with the electronic health records becoming more and more common, we are going more into the cyberspace. That's where a lot of the work is being done, which is convenient for a lot of reasons, but at the same time, it exposes us to these risks. And so, and at the same time, there's a lack of education. You know, whenever we try to institute policies of multi-factor authentication or try to limit access to information in a healthcare setting, it's very difficult because that culture of cybersecurity awareness is still lacking. So we have a lot of these risks that are developing along with the innovations, and that's exposing us to this vulnerability. And then now with evolving technologies, and I hope we have a chance to discuss that in more detail, whether it's generative AI or machine learning algorithms, it's becoming more difficult to understand what is real, what's not real, the phishing emails or other scams. So this is the landscape we find ourselves in.
Let's hear Mike, because I know NHS had its share of cyber attacks that delayed appointments, that disrupted hospitals in the UK. Can you give us an overview and the history of these attacks and their costs and repercussions?
Yeah, sure. So I think the first point I'd make is to really challenge the narrative that this is an ever-increasing threat that is accelerating and unpreventable. I think the experience within the NHS, particularly looking back 7 years to the WannaCry wormable ransomware attack that caused significant patient impact and became the start of a journey of improvement. When we look from there to now, actually we are seeing a plateauing, not in the tempo of attacks, but in the success of those. So it does, to me, demonstrate that with a range of solutions, actually we can stop the tempo. And for me, this is about making it a patient safety issue rather than a technical cybersecurity one. So yes, we need to address the foundational failings that we see time and again in attacks in the health sector, the absence of multi-factor authentication, the failure to patch or protect against known vulnerabilities. But we need to talk about the patient impact to ensure that the funding is there as we go on this rapid digitalization of the health. So I do firmly believe that by implementing strategic policies such as the UK policy position that we will not pay ransoms to criminal groups, combined with national level technical platforms and then local level education, it is a challenge that can be met.
How many attacks have you experienced this year? Are they on the rise?
So we have national visibility over 200 hospitals in the UK, covering over 2 million computers, endpoints, and the team that do that deal with thousands of incidents a year. In terms of ones that then have patient impact, it's in the very low numbers as a result of those controls that are applied. But as you kind of refer to in the initial question, there have been high-profile ones, particularly in the supply chain, and that's where we see a vulnerability. So in a recent attack on a London pathology lab, we know that over 10,000 outpatient appointments were deferred as a result of it. We know that over 1,500 inpatient procedures were, and that's the important thing for me about bringing this back to the patient harm, in parallel with putting a financial cost on these attacks.
And can you share with us some information about the source of these attacks?
So I think there's an inevitability of the desire to attribute and find the root cause of these. Within the UK, we face a ransomware epidemic, and as has already been commented on, we are uniquely vulnerable in the health sector because of the sensitivity. Health in the UK is responsible for about 10% of GDP, so we are financially motivating others. But in terms of that attribution, actually, in many cases, it is difficult because of the way in which these attacks take place. But we do see criminally motivated financial actors that are hitting all sectors that are, by the nature of the model that ransomware groups operate, affecting health as well.
Thank you, Mike. Dr. Richard, Junaid mentioned something in regards to AI and generative AI and using these technologies. This is a theme that I've seen on every panel in this forum. So how do you balance adopting these new technologies at the same time not risking increased cyber threats?
Yes, so the adoption of AI is obviously being done for various very solid reasons, right? Artificial intelligence plays a massive part across healthcare. We have, as an industry, been using machine learning to help with clinical diagnosis, right? Clinical decision support, going back 10 years or more in many health systems. And that is using data and evidence-based medicine in order to prescribe the best course of treatment for a patient based upon the evidence, based upon the statistics, based upon the clinical histories of thousands of other patients who have presented at a similar age, similar gender, similar conditions, medical conditions from a similar background. Instead of physicians using purely their intuition and their training, they're able to supplement that with machine learning based assistance. We're also seeing AI used extensively in radiological imaging today, right? So instead of a patient receiving a high-dose CT scan, which has a negative impact because of the radiation on a patient, in fact, a certain percentage of CTs actually cause cancer. So I think many of us in the medical profession are very reluctant to undergo excessive scans for that very reason. But thanks to AI, we're now able to use low-dose radiation and then enhance that image with artificial intelligence so that that image will show us cellular mass changes that are indicative of the onset of cancer before cancer even erupts in the body, right? So we're able to catch that early, and early diagnosis means much less intervention, much less inconvenience to a patient. It's cheaper. And there are a whole load of reasons as to why we continue to enhance our adoption of AI algorithms for medical imaging. I think the biggest single breakthrough, though, is going to be around precision medication, right? And that's not really here yet, but we're on the cusp of it. If you're very wealthy, then precision medication may be available to you, but for the general population, it's not yet. And by that, what we're doing is mining vast lakes of data, understanding the genome of a patient, right, DNA, and customizing drugs to an individual, to their condition, to their genome, to their predispositions to certain medical ailments, and we're able to make magic pills, if you want to put it in those terms, with a high degree of efficacy, a high degree of accuracy, to cure diseases without the need to, cut open patients and remove tumors and these sorts of things. We can, again, interrupt the medical decline of a patient much, much earlier. But that raises risks around, the security of the vast data lakes that are needed to build those AI algorithms, and how we protect that data, and then how we protect the AI algorithm from things like data poisoning and various other forms of AI attack that could run a risk of damaging that artificial intelligence.
Mike, before moving to you, Junaid, I want to hear your thoughts. How excited are you, or reluctant, of embracing these technologies, because you are worried that you don't have the digital infrastructure to protect yourself from introducing these technologies?
Yeah, so I think the answers to the challenges of healthcare, particularly in the UK, have to lie in technology. We cannot have a more productive workforce without embracing the technology. And within, for example, the app, the NHS app that's used, in 4 years, we've seen it go from 1 million users to 33 million users. And that means that there's an extra 32 million people who don't have to phone their GP if they want to make an appointment. They can do it digitally. So we absolutely have to embrace it because of the productivity benefits. But we work in a really complex system. And I think as security professionals working this, we need to find comfort in the complexity, yet look for simplicity in the solutions. And that, for me, is we're focused on AI this year. Previously, it may have been the metaverse. A couple of years before, it may have been blockchain. The new technologies come along, and the generative AI has really focused the opportunities. And yet, the simple approach to this is to look at it in terms of risk management and balance out those clinical benefits with what the costs are, in some cases unknown, but really kind of work with our clinical partners to understand that and embrace the technology, but in a manner in which they are comfortable with.
But I think the buzz on AI will last much longer than the buzz on the metaverse, in my humble opinion. Junaid, you wanted to comment on this?
Sure. So I wanted to go back to one of your questions about the numbers,
Yeah,
and how big of a threat it is, at least from a US perspective. So according to the recent data from the Department of Health and Human Services in the US, in the last 6 months until July 2024, we've had around 340 cyber attacks on healthcare facilities. And in 2023, that was the cyber attacks increased by 93%. And that was a 300% jump to what was happening a year before. So you can see that there's this exponential rise in cyber attacks. And that is stemming from the fact that it is very valuable data. But at the same time, I think it's also maybe an indication that the healthcare organizations are not focused on it in a way that they should be. For example, financial institutions and other organizations that hold sensitive data. So we need a lot of work there. And every country has its own regulatory mechanisms, especially in the US, where healthcare is quite fragmented. It's sometimes difficult to have policies that you can apply throughout the country. Although we've had some success in that, but it's often difficult. Going back to the question of AI, I'm an optimist by nature, so I always like to see more benefits, but I'm also cautious about some of these technologies. And I agree with you. I don't think this is like the metaverse. I think this is going to change the future. How it will change the future, that's probably up to us, right? Because when we focus on whether it's cybersecurity or other technological innovations, we often think of the technology itself. But like Mike was earlier referring to, we have to keep the patient safety in focus. That's number one. And we also have to understand the human in the loop, as was mentioned earlier on the panel discussion by the expert in psychology. We have to see what is the human person in this loop doing. How are they part of the equation? We can't just focus on the technology and think, well, this is going to take care of everything. So I think being mindful of that and balancing those elements where you have enough attention on the human side and then using technology as a tool, I think that's when we will come to a place where we can have a very balanced approach, whether it's cybersecurity or other interventions we have in healthcare.
Thank you, Junaid. Dr. Richard, let's discuss now the global frameworks that we have that can increase cyber resilience for the healthcare sector. We have two widely recognized standards and frameworks used for managing this. We have the ISO 27001 and we have the NIST CSF. I believe the first is more global, the second is more used in the United States. Do actually these frameworks increase cyber resilience in the healthcare sector?
I believe they do, and for the sole reason that they put within a framework all of the aspects of an industry or a business that needs to be secured. By that, I mean security is only good as its weakest link. We have a history in all of our industries of perhaps building an impregnable front door to a building, but forgetting to put window locks, right? Or to replace the broken lock on the back door. And it's important to look at this from a holistic perspective to understand where the risks are, a risk-based approach rather than perhaps a compliance checkbox approach, which the industry has a history of prioritizing perhaps over risk. We need to change that. And those frameworks allow us to understand not only the risks, but also the effectiveness of the controls that we have in place to protect against those risks. And in fact, you know, there are three cybersecurity frameworks, two used widely, as you mentioned, but there is no reason why you can't overlap those risks. So in the United States, the federal government has pushed the NIST CSF framework, which is very comprehensive. But a lot of healthcare institutions are overlaying ISO 27001 technical controls within the NIST cybersecurity framework. The goal, of course, is to make sure that no stone is left unturned and that we have effective, all-encompassing, holistic security.
Thank you. Mike, what are your thoughts here about the importance of these frameworks, and do they need any adjustments?
Yeah, so I think in the inevitable desire to seek tension between the panel members, I had a slightly different view on this. So I think frameworks are critically important as a skeleton, as something for us to hang our business offerings over and make sure that we are consistent in the manner in which we approach the risk management. However, my experience within incidents and as an operational leader in this space is that many of the frameworks, for example, the one used in health in the UK has over 160 different attestations and things that IT leaders and clinical leaders must validate themselves against and check against. And yet within cyber incidents that I see, it's literally one of 3 or 4 foundational weaknesses and failings that I see. So for me, the sweet spot here is merging from those frameworks into the narrative and the compelling stories that we can tell of those that are making decisions so that they do focus on the application of multi-factor authentication, of maintaining their IT, and keeping it secure, whilst also using that framework effectively. And just to pick up on a point that Junaid made earlier, I feel that we're in a really kind of amazing opportunity at the moment, particularly with artificial intelligence and some of the additional computing capabilities that are needed with AI, but also with the rollout of electronic patient records in the health sector, in that you can't use the out-of-support, out-of-date IT to make those capabilities work. And so I think we really do have an opportunity of pivoting and saying, well, actually, the business benefits to you here are in running your IT well and securely against the security frameworks, but not making the security case the primary one for it, making it about the business benefit and the clinical improvements that we will get out of running IT well managed.
And is there room for global cooperation in a different way in terms of sharing best practices with institutions like yourself. Are you currently doing that? And do you think that this can significantly help the healthcare sector to increase its cybersecurity resilience?
I think the frameworks are really well established. We've spoken about some of them. I think many people know what needs to be done. I think what we need to focus on is why it is that we're failing to make the argument successfully in the C-suite and at the board level. Why is the investment not being made in these such that folk like ourselves here can apply those frameworks? Because in many cases, the gaps are well known. It's just that the funding hasn't been provided to enable those frameworks to be kind of ticked off and all of those controls deployed.
Junaid, looking ahead in the future, we have still a few minutes left, so let's keep it for a future outlook on these threats. What are the emerging threats that you see in the healthcare sector?
I think going back to our discussion about technology, it's just like there are benefits to employing machine learning and AI to protect. In the same vein, there are threats from this technology, right? We have seen that generative AI can create very similar looking web pages, for example, or other phishing emails, or other elements that are very easy for people to confuse for a real web page or an email. And then that increases our vulnerability. So I think that's where a lot of this, the technological discussion should go as well, because we need to balance it with the pros and the cons. And then there is also an element of weaponization of healthcare data.
In what sense? In what sense?
In the sense that it is sensitive, and it can be used against people, because it's not like other data where, like I said, you could reset it or you could change some of those elements. It's still at a stage where the threat is more organizational. You might have heard in the news about Changed Healthcare in the US, that they had to pay for a ransomware around $22 million. But the damages could be well above $1 billion. So it's still at that institutional level, but that could also happen at an individual level. So there is that threat of that issue. At the same time, there is also, like Richard was saying earlier, we could automate some of these processes, because these technologies do allow us to synthesize outputs for a very large amount of data, which is not manually often possible. So I think that is an opportunity for the future. And like I said, I see more benefits than losses in the future, but we have to be careful as we implement these technologies.
Dr. Richard, how worried are you about the future? How worried are you about the weaponization of medical devices? This is something that we see it usually in the movies.
It is, and this conversation becomes very Hollywood-esque very quickly, right, if we go down that particular road. I think there is a danger that as we adopt new medical technologies, we do not keep up with the level of cybersecurity necessary to protect those technologies. We have an insatiable appetite to adopt AI and a huge growth in medical devices, as you mentioned, in our healthcare system that allow us to automate patient monitoring, management, diagnosis and treatment, which obviously leads to greater levels of efficiency. But all of these things introduce risk. The danger that we need to be aware of is the development of a maturity paradigm. And by that, I mean our adoption of technologies outpaces our adoption of cybersecurity to protect those technologies. And coming back to what Mike said earlier, it's about prioritization. We are not prioritizing cybersecurity to the sufficient level that we need to, given the magnitude of risks. Now, if we compare healthcare with other critical infrastructure industries, if a pipeline gets hacked and broken down, or an electrical distribution system gets taken down, it's an inconvenience, right? It has an impact to the economy, Many industries may close down as a result of not receiving gasoline or jet fuel, as we saw with the Colonial Pipeline attack in the United States recently. But no one really dies as a result of that. If healthcare is taken down because of a ransomware attack, there is a direct impact on patient morbidity and patient mortality. And while we could talk about statistics, I think what really brings it home is if someone is in a hospital that is a relative of yours or a friend of yours who is negatively impacted because the health IT systems are not available to treat them because they've been ransomed by a cyber attacker. And this is what we need to prepare against. This is what we need to build in cybersecurity controls and resiliency in order to sustain the types of attacks that we're beginning to see. And protect against them.
But are there any documented attacks on medical equipments that led to the death of the patient, whether intentionally or unintentionally?
So I'll refer you to the work of a New Zealand hacker by the name of Barnaby Jack, who in 2011 was able to use simple RF wireless signals to attack an embedded infusion pump. A drip system within a patient to administer diabetes insulin medication to the patient. And they were able to, Barnaby Jack was able to change the drip rate on that system to the level that the patient would have received a lethal dose of medication and put them into hypoglycemic shock. The following year, he hacked a pacemaker on stage at a security conference and was able to administer an 815-volt shock directly to the heart of a patient that would have been lethal, right? Since then, we've seen a number of hackers attack all kinds of medical devices, whether they're embedded, implanted, or whether they're external systems like a simple infusion pump or a radiological treatment system to give lethal doses to a patient. This is what we need to build controls to prevent against. We have seen a number of patients that have died as a result of ransomware attack. There are 2 in the public domain. One, an elderly German woman who presented with a cardiac aneurysm at the University of Düsseldorf Hospital, and her ambulance was redirected to another hospital in Wuppertal, 20 or 30-minute drive away, because the university health system was under attack by ransomwares. She died shortly after arrival at Wuppertal Hospital. We also, in the United States, had an infant born recently who the mother presented at the hospital to give birth. Her obstetric team were there, but neither the mother or the doctors or nurses had been made aware of the fact that the hospital, the medical center, was under cyber attack, and the fetal heart monitoring systems, fetal ultrasound systems were unavailable. The mother gave birth, there were birth complications, the umbilical cord was wrapped around the baby's neck, and the baby was born with severe mental retardation as a result of oxygen deprivation, and that baby actually died 6 months later. There are many, many more patients who have died as a result of ransomware attacks. And the reason I mention this is not to scare everyone, but to relay the importance of protecting the healthcare industry from these types of attack, because we are all users of healthcare from the moment we're born to the moment we die, and we all know someone or have a relative that is perhaps a more frequent user of healthcare services than we may be.
Our time is up, but I would have to hear your thoughts on this, Mike. And how worried are you about the future, about the possibility of weaponization of medical equipment and the possibility of using the stolen data to create bioweapons?
So I think it's important to differentiate possibility and probability here. The reality of the threat that we face at the moment is largely focused around financially, criminally motivated actors, combined with, in many cases, unintentional or intentional insider activity, either through cyber and IT or elsewhere. So I'm hopeful for the future. I think there are some key asks on the vendors, on the suppliers into the health sector to embrace secure by design principles, to turn that tap off such that the legacy issues that we already have are not featured in future products that in many cases have long lifespans. But I think by focusing on the risk, minimizing the harm from that which is endemically caused by financially driven criminals as opposed to the niche cases of the possible, then I think we can have a really digitally enabled health system that is globally secure.
Thank you all so much for sharing your valuable insights with us today. Thank you for attending. A big round of applause to our panelists. Thank you.
Thank you.